morning, church. Thank you for having me here today. I've been asked to speak on the subject of women's health. I think that we can all agree that women are human beings, can't we? And therefore, any affliction that human beings have, we can expect women to also have that. But they have some organs that are peculiar to themselves. And therefore, I'll be putting my emphasis on that today. I'm told that men are invited to this discourse because they have to become sensitive to the women when they complain about certain afflictions. So men are also invited so that they can understand when their wives complain. Women's health. For today, the definition of women will be females after the menarche. That is, as soon as their periods they start to have periods, we'll regard them as women for today. And so, women's health includes, from that young lady you see there, to postmenopausal women and beyond. The first introduction to womanhood, I suppose, girls have is when they start to have menstrual cycles. And some people say that a menstrual cycle is a uterus that is disappointed and weeping. They say that because what really a menstrual cycle is a thickening of the lining of the uterus. You see something marked endometrium there on the lining of the uterus. It is a thickening of that lining that occurs in the menstrual cycle, expecting a baby or fetus to implant there. So you can regard it as making up a bed for somebody to get in there. But when the uterus discovers that no fetus is coming, it weeps and therefore it sheds that lining. You can imagine that you are taking off the cover from the bed. And that's really what a menstrual cycle is. It's a shedding of the lining of the uterus when a fetus does not implant there. Now, girls or young ladies, when they start to observe cycles, discover pretty soon, in over 80% of them, that this thing is associated with some pain. In many women and young ladies, it's associated with pain and it's called dysmenorrhea. Dysmenorrhea. And there are two types of dysmenorrhea. There's what is called primary dysmenorrhea and secondary dysmenorrhea. I have listed up there the causes of secondary dysmenorrhea first. The first one is something called endometriosis. And what endometriosis is that the menstrual fluid, instead of all coming out the right part, sometimes refluxes through the tube and gets implanted in different parts of the abdomen. So it can implant at the navel, it can implant in the pelvis, and when the periods come, these cells that are implanted, they react the same way. They become swollen and engulfed, and so you have a lot of pain related to the implantation at the navel and elsewhere. And then you have what is called primary dysmenorrhea, which most young ladies experience. And just before the start of the menstrual cycle, or soon after it starts, it highlights itself by pain in the lower abdomen, hip and back, and maybe associated with nausea and vomiting. This primary dysmenorrhea is caused by a hormone called prostaglandin. Prostaglandin causes contraction of the uterus. And because of the contraction of the uterus, the endometrium or the lining of the uterus gets a poor blood supply, and that is what causes pain. Any organ that gets poor blood supply, whether if it's your heart, then you get angina. If it's your leg, then you get a problem with the leg, pain. So the endometrium becomes depleted of blood supply, and therefore you get pain. Now, that primary dysmenorrhea can also have some other contributing causes, which is obesity. Women who are obese tend to have significant dysmenorrhea. Of course, there's a range of discomfort. Women who are obese may have severe dysmenorrhea, or if the uterus is retroverted. Normally, the uterus has a tilt to forward in the abdomen. If it turns backward, that's something that happens naturally. If it turns backward, then people like that may have severe dysmenorrhea. And social stress and menarche, which is starting having period before you are 11 years, are all associated with severe dysmenorrhea. Now, the symptoms of primary dysmenorrhea, I told you already, these are the symptoms of secondary dysmenorrhea. In secondary dysmenorrhea, which are caused by fibroids and you saw endometriosis and otherwise there, that dysmenorrhea tends to be a more severe dysmenorrhea. It tends to start before the period and last throughout the period. In primary dysmenorrhea, the most intense pain is within 24 hours, and then it disappears gradually over 3 days. In the case of secondary dysmenorrhea, this pain may start before the period and last for several days. It's continually there. Now, the treatment of dysmenorrhea. Primary dysmenorrhea is usually treated with drugs such as Motrin and aspirin and birth control pills. The birth control pills provide certain hormones which ameliorate the pain. This can be supported by heating pads and some gentle massage and so forth. It tends to be self-limited, and therefore, that's the end of that. Secondary dysmenorrhea is treated with the same type of pain medication, but you also have to address the cause of the dysmenorrhea. For example, if it is caused by fibroids, then you might have to deal with the fibroids. If it's caused by endometriosis, then you have to deal with the endometriosis. If it is caused by adenomyosis, which means that the endometrial tissue grows inside the uterus, then you have to deal with that, besides treating it symptomatically. Another problem that is related to the periods is what is called menorrhagia. Now, some people have extremely heavy periods, and rather than having to use probably one pad a day, they may have to change a pad every hour, or they may have to use double pads, sanitary pads, or they have to get up at nights to change pads, or they may be bleeding for more than a week, which restricts their activities, and they may become anemic. Anemic means that your blood count is low. You have low iron in the body. Now, that is menorrhagia, and it can make some people sick, make it very difficult for them to work because they have to address this all the time, and it happens every month. Now, these are some pictures of fibroids, and you can see that fibroids can be partly external to the uterus on the left there. You can see it can be in the wall of the uterus. You can see it's a button to the inside of the uterus on the right, and you can see it can be inside the uterus. Well, particularly those that are inside the uterus and on the margin of the uterus, they tend to cause very heavy periods. And that's one cause of menorrhagia, but let's look and see. There's a list of other causes of menorrhagia. One of the commonest causes of heavy periods like that is hormonal imbalance. There are two particular hormones that tend to control the periods. One is called estrogen, and what estrogen does is to build up the lining of the uterus, make it soft and nice for the fetus to implant. And then there's one called progesterone, which controls the thickness so that it does not become too thick. Well, when you have an imbalance in both of them, the lining of the uterus may become very thick. And therefore, when the period comes, it can come very, very heavy, because if you imagine a normal uterus menstrual cycle is a sheet and a bed. In the case of menorrhagia, it is how you call that very thick thing you used to cover the bed? A what? Just this me. You know the thick thing that you dress the bed with. Not a blanket, thicker than a blanket. Yes, yes. So you can imagine that in the case of menorrhagia, that's what the uterus has to shed. And therefore, you bleed very, very heavy. Then another cause of menorrhagia is ovarian dysfunction. The ovary is very key to menstrual matters. And every month, normally, one of the ovaries produces an egg. And when it produces an egg, it also produces the hormone progesterone, which limits the thickness of the lining of the uterus. If the woman does not produce an egg during the menstrual cycle, excessive progesterone, adequate progesterone is not produced, and the lining of the uterus becomes very, very thick, and therefore you have heavy menstrual cycles. Another cause of menorrhagia is intrauterine devices. Intrauterine devices that are used to prevent pregnancies. Bleeding disorders. There are certain congenital conditions that make you bleed, such as von Willebrand's disease and other congenital causes of bleeding. So if you have those congenital causes of bleeding, then you will bleed excessively. Certain cancers and tumors inside of the uterus may cause menorrhagia. Well, how do you manage the menorrhagia? I'll start from the second to last one, your future childbearing plans. Now, one of the treatments for menorrhagia is, of course, dealing with fibroids. And if you have a young lady with menorrhagia, one of the treatments for fibroids is removal of the uterus. You will not want to remove the uterus in somebody who is childbearing and would like to have a baby. So so you have to consider that in the management. Then tolerance for certain drugs. Some people can't tolerate Motrin, some can't tolerate aspirin and so forth. And therefore, if you want to use medicines to treat them, you have to be very selective in what you use. Then, of course, how long the person will have to bear this menorrhagia. Suppose the person is now about 48 years and having this very heavy bleeding. You could expect that the problem will be short-term because within 2 years, the individual is going to stop having periods, and therefore that's the end of that problem. Whether you have fibroids or whatever it is, you don't have to worry about that. So generally, you have to evaluate the person's overall health situation to decide how to manage them. So menorrhagia can be managed by birth control pills, which sort of regulates the hormone that may cause it, or progesterone, the hormone that limits the thickness of the uterus, and other medications. But of course, if the problem is a problem with the uterus, then myomectomy, which means removal of the fibroid, it may be fibroid or fibroids, polypectomy, which means removal of a tumor, a polyp that is hanging inside of the uterus, and hysterectomy. Those are all some of the managements depending upon the situation of the patient that you may have to use. Now, let's talk a little bit about fibroids. I'm sure everybody here has heard the word before. And you can see that fibroids are non-cancerous tumors of the uterus. You can have one, you can have multiple fibroids, and as you can see, they may be located in different areas of the uterus, outside, in the wall, and within the lumen of the uterus. The prevalence of fibroids. Well, 30 to 40% of women will develop fibroids within their lifetime. And when it comes to Negroes, well, they have 50% or more Negro women will have fibroids develop. And the fibroids that are in Negroes tend to be larger. Fibroids are more common in nulliparous women. That means women who never had children will have a greater probability of developing fibroids. The adverse effect of fibroids. Well, they may cause, as I said, very heavy vaginal bleeding. They may cause difficulty with fertility because the fetus has to implant, and if the fibroid occupies a significant portion of the uterus, the bed might not be suitable for implantation. Then they may cause pelvic pain and obstruction of urine, and also cause constipation and problems with pregnancy. Because when a lady is pregnant and she has to deliver, there's one exit for the baby, and if a big fibroid is there, it may cause a problem for the exit of the baby, or it may cause the baby to lie in an abnormal position during the pregnancy, and therefore you get things like breech and transverse lie, abnormal positions, which may require you to have a C-section. Also, during pregnancy, fibroids tend to degenerate and cause constant pain throughout the whole pregnancy. How do we manage, and this is important because many people get bad advice outside there because some physicians would like to make some money, but management of fibroids. If a fibroid is causing no problem, it does not become cancerous, so the treatment is to leave it alone. So you don't necessarily have to remove fibroids if you have an ultrasound and the doctor says, well, you have fibroids in the uterus, it never caused you a problem, just leave it alone. Symptomatic fibroids, the treatment may be myomectomy, which means removal of the fibroid or fibroids, or hysterectomy, which means removal of the uterus itself. So suppose a lady is 48 years old and she has an ultrasound and the doctor says, well, you have some fibroids there. And you go to a doctor and he says, well, let's do a hysterectomy because you have fibroids there. The point is that the fibroids are causing no problem, and certainly they may even shrink after menopause. 48 means within 2 years you are likely to start menopause, stop having periods. So you just leave the thing alone there. And depending upon the number and size and age of the patient, you decide how you treat the patient. So a younger person who is infertile or trying to become pregnant and she can't become pregnant and there are significant fibroids there, such an individual you might consider removing the fibroids to increase the probability of pregnancy. We're talking now about cancer of the lining of the uterus, the endometrium. This is an example. You can see there. That doesn't look like the uterus I showed you before. There is a cancer. It's called endometrial cancer. Symptoms of endometrial cancer. Vaginal bleeding after menopause. Some women think that they are becoming younger after they have stopped having their periods. 5 years afterwards, they start to have what they think is a period, and they think they are becoming younger. Well, that is not the case. As a matter of fact, you should be very worried, because if you start to have bleeding after menopause has set in, then you certainly should go and get checked, because one probability is that you may be developing endometrial cancer. That is cancer of the lining of the inside of the uterus. A vaginal discharge, pelvic pain, irregular bleeding before menopause, and pain during coitus. All of those are symptoms of endometrial cancer. And who is at risk? Fertility drug treatment. After menopause, some women have severe postmenopausal symptoms. I'm talking about hot flushes and sweating and mood changes and all of that. Some women are very distressed by that. And therefore they go to their doctors, and those postmenopausal symptoms are caused by a diminution of the ovarian function, and therefore you do not have the normal ovarian hormones. That's what causes postmenopausal symptoms. So it seems logical that to treat it, you should replace those hormones. And indeed, replacement of the hormones may diminish the symptoms. But one problem it may cause is endometrial cancer if you take it for a long time. Then another risk that increases endometrial cancer is nulliparity. Women who have no children stand a greater chance of developing endometrial cancer. And then there are two genes called BRCA1 and BRCA2. Those two genes are very important in cancer of the breast, but they are also very important in predisposing women to, they are genetic changes that take place within the uterus, within the system. And because of those genes, women have, those who have those genes, mutation of those genes, they have a greater probability of developing cancer of the uterus. People who smoke, women who smoke, and women who have what is called polycystic ovarian syndrome. Polycystic ovarian syndrome is where it's a fairly common thing. About 20% of women will have that. The ovary produces a lot of cysts, and these cysts produce male hormones, which tend to predispose to endometrial cancer. Management of endometrial cancer. Well, the treatment is total hysterectomy. That is, you remove the whole uterus, you remove both ovaries, and you remove both tubes. And depending upon how extensive it is, you may also have to have radiotherapy and chemotherapy. That's the standard treatment. So essentially, these things, whenever you notice an abnormal sign like bleeding when you're not supposed to have bleeding, intermenstrual bleeding, it should be a sign, a flag that you should go to your gynecologist and have him check. You don't want to discover that you have this when it has spread all over the abdomen. Cancer of the cervix. The cervix is the opening of the uterus. That's a part of the uterus. So you see the endometrium is the part inside of the uterus. It looks like a T, and the cervix is the pointed part down. Cancer of the cervix is the second commonest cause of cancers in women. Very, very significant disease. And I'm sure you may have heard a lot of it, about it recently when they were talking about vaccination against cervical cancer, because it's a very significant disease. And you may not be able to see this slide, but it's talking about the causes of cancer of the cervix. And one of the commonest causes of cancer of the cervix is a virus. Now, abnormal bleeding caused by, sorry, I want to go back there. Yes, it's papillomavirus. Papillomavirus is a virus that is transmitted sexually. And anybody who has participated in that, particularly if you have multiple partners, sexual partners, you'll get introduced to papillomavirus, which takes some time, but it will later develop into cancer of the cervix. And the earlier a female is exposed to papillomavirus, the greater her chance of developing cancer of the cervix. Now, cancer of the cervix presents itself as postcoital bleeding. You may just notice some spotting, or you may just have vaginal bleeding, or you may have pain, or you may have frequent burning and micturition. When you pass urine, you may have burning. So it may present in all of those forms. Of course, vaginal discharge, which may be foul, and of course, I think I mentioned those there, pain during sex. Now, you do not wait for these things to happen for you to check to see whether you have developing cancer of the cervix. Cancer of the cervix can be discovered 5 years before it becomes apparent by just having a pap smear. If you have a pap smear, then, and they said that, well, there's no problem there, then you are good for 5 years. But if you have a pap smear and they said, well, we are seeing papillomavirus, then you better look out. because it means that you have to be checked more frequently to see if changes are developing there. So this is something that you can certainly prevent by just having frequent checks with your gynecologist. I should mention how you treat cancer of the cervix. Cancer of the cervix can be treated by surgery if it is discovered very, very early. That is, just in the lining of the cervix. You can remove the whole uterus. You'll have to remove the whole uterus and tubes and ovaries. But as soon as it goes beyond the first stage, you have to treat it with radiotherapy and chemotherapy. Radiotherapy and chemotherapy. Radiotherapy and chemotherapy has its adverse effects, but that's the only option the person has. Talk about the breast and breast lumps. Well, you know, there are many lumps that can arise in the breast. You have cysts. Cysts are collections of fluid like a bubble filled with water. And these cysts can contain clear liquid, or it can contain straw-colored liquid like urine, or it can contain bloody liquid. They can be pure cysts, or there may be a mass in the cyst associated with the cyst. Then fibroadenomas. Fibroadenomas are non-cancerous tumors. They are very similar to fibroids of the uterus. Then there's fat necrosis. I noticed that women these days are boxing. They are involved in boxing. And if a woman gets a severe blow to the breast, I think that they protect that in the boxing, but if you get a severe blow to the breast, you may get what's called fat necrosis. A mass will appear there that takes long to disappear. And you may have something called duct ectasia, which is an inflammation of the milk ducts. And you have what is called Paget's disease of the breast. Paget's disease of the breast is something like an eczema that comes around the nipple. It occurs in the pigmented part of the breast around the nipple. Many people think that all they have in there is a little rash, and they may go and put a little, you know, that pine, what do you call it? Okay, let's forget it. People plant it and they sometimes drink it. Aloes, that's what. May go and put a little aloes and all sorts of things, thinking that it is a little rash. But if you leave it, all of a sudden you'll find that it will go to the nipple of the breast, and then the nipple becomes eroded, and you discover sooner or later that it was really a cancer. Paget's disease of the breast. And then you have, of course, pure cancer of the breast. So what do you do with these lumps? Cysts of the breast, we just put a needle in it and aspirate the fluid. Once it's not bloody, nothing to worry about. It is caused by the menstrual cycles. Hormones are stimulating the breast, and it produces cysts. So if you have a cyst of the breast, the treatment is just to suck out the fluid, and it doesn't come back. It may come back elsewhere in the breast, but that's the end of that. Fibroadenomas, very, very common in young people, in teenage and 20s and so, and they are usually very smooth, they are firm, and in the United States, they will follow it and biopsy it. In Trinidad and Tobago, since people don't have money to keep on having tests and tests, we just remove them. If they're superficial under local anesthesia, if they're deep inside, move them under general anesthesia. Certain types of them can become very large and become a malignant process. Fat necrosis is just treated symptomatically. If you have pain, you just put some heating pad and some aspirin or Panadol, and that's it. Duct ectasia. Some women may notice that if they squeeze their nipple, something milky comes out of the nipple. Or they may notice that at the time of period. It is not of significance except what comes out is bloody. If there's blood at all in discharge from the nipple, you have to worry about either cancer of the breast, or you have to worry about something called a papilloma. That is a non-cancerous polyp inside of the breast. So any bleeding from the nipple should be checked by your doctor. And then, of course, we come to cancer of the breast, which is one of the more common dangerous cancers in women. 1 in every 8 American women during their lifetime will get cancer of the breast. 1 in every 8. And it appears that it may be environmental factors, because in Japan, cancer of the breast is not that common, but when a Japanese migrates to the United States, the incidence becomes the same. So it might suggest that it's something environmental. And cancer of the breast is one of those conditions where if it doesn't pain, leave it alone, does not apply. You know, because cancer of the breast invariably does not pain. It feels like a stony lump inside of the breast, a hard lump, like a stone. So don't think that if it does not pain, it is of no significance. It is like a stony lump, and bloody discharge from the nipple. You may have bloody discharge from the nipple. Then you may have a depression of the breast when you raise the arm. If you stand up in front of a mirror and raise your arm like this, and you have a cancer of the breast, at the site where the cancer is, you'll see that it becomes depressed. It's like you pull in a tent. You'll see that it will do that. So that's one worrisome sign. A second worrisome sign is that the skin changes, and you'll see it will become like orange peel. You'll see a lot of puckering on the skin. So if you see that, you better start to get worried. And of course, I mentioned before about the eczema around the nipple. The nipple may become inverted. Most women have protruding nipples. All of a sudden, you notice that the nipple starts to go inside of the breast. And that's a worrisome change. And of course, any change in size or the contour of the breast may also be worrisome. So when you see any of those things, you cannot see those changes and leave it alone. What are the causes of breast cancer? Well, breast cancer is caused by a mutation of the gene in the breast. Like many cancers, you know that what codes for any change in your body is a gene. And when you have a fracture in the gene, then it causes cells to behave abnormally. And when I say abnormally, when I was a baby, the size of my head is like this. That's what they tell me. The size of my head is like this. But it doesn't stay like that. As I grow, my head is getting bigger. But it doesn't keep on growing and growing and growing. There's something that tells the head, stop growing. Well, a cancer is different from that. When the cells start to multiply, they just multiply and multiply, and there's no control in the cell multiplication. And two genes that may cause that is BRCA1 and BRCA2. That's an inherited gene. Somebody, a lady who never had a problem, the cell may mutate and produce those genes, and then the daughters afterwards if the mother has cancer of the breast, the daughter may develop cancer of the breast and develop it earlier than the mother. So that some women, if they have those genes, some people in the United States do a prophylactic mastectomy when they discover that. In other words, before they get cancer, they remove the breast and put in a prosthesis to prevent themselves from getting cancer of the breast. Obesity. Women who are obese tend to get a higher incidence of cancer of the breast. Women who are nulliparous tend to get a higher incidence. Postmenopausal hormone treatment, alcohol use, family history of cancer of the breast, and if you have the first pregnancy after 30 years of age, increases your chance of having cancer of the breast. Why is that so? The point is that the uterus the breast would have been used for over 30 years, or well, probably 20-something years, to a certain amount of female hormones. When the person is over 30 years and becomes pregnant, there are a barrage of hormones that impact upon the breast, and that increases the chance of the woman having cancer of the breast. As a matter of fact, one of the most malignant forms of cancer of the breast tends to happen when the person is pregnant. Now, how do we detect cancer of the breast? A very important exercise is self-examination. Self-examination, because many times people come and they are discovered to have cancer of the breast when they go for their general checkup, and it's a little bit too late. And you must never assume anything. Just recently, as a matter of fact, I see probably about 3 or 4 cancers of the breast per month. And recently I had a lady. She had cysts of her right breast over a period of time, and she'd go to her doctor, and he would aspirate the cyst, and that's the solution. After a while, she said, well, I'm not going for that. He just puts a needle there and aspirates the cyst. A mass appears on the left breast. She assumed that it was a cyst, and when it started to pain, only then she came because she said, I have a painful cyst, but she had a huge cancer of the breast, which had spread elsewhere already. You see? So self-examination, and when you examine and you find something abnormal, then certainly go and check. And why is self-examination important? Because there are some women who have lumpy breasts, multiple cysts in the breast or multiple fibroid adenomas in the breast. Which one is a cancer? They don't know. But if you know the topography of the breast, you know how each breast feels. When something new announces itself, then you know you must go and get it checked. Or if something is getting bigger, then you know you must go and get it checked. You see? So that's how you discover from self-examination. If you discover something, then an ultrasound is one way, particularly for women who are under 40 years of age. An ultrasound is an appropriate examination. The reason is that women who are under 40 years of age have very dense breasts. And if you go and do a mammogram, you may not see the detail that you need to see. So, under 40 years of age, an ultrasound. Above 40 years of age, mammogram. And the mammogram done, say, every 2 or 3 years will discover breast lump before they become a lump. You'll see certain changes in the breast. There are certain, what is called microcalcification. If you see this microcalcification, there is no mass there yet, but you see the microcalcification that tells you that the cancer may be just a few cells old. And if you deal with it at that time, then you expect a good prognosis. Having discovered a mass, the next step is a biopsy, because X-rays and ultrasounds and so forth cannot make a diagnosis, it just suggests a diagnosis. And once cancer is discovered, the treatment would be two things. Either what is called a lumpectomy and axillary node dissection. Some people say that don't operate on the cancer because once you let it get exposed to air, that's the end of you. It's the greatest fallacy that ever existed in this world. The sooner you deal with it, the better off you are. I have multiple people going 20 years after cancer operation, and they are fine because they dealt with it very early. So you must follow the protocols that have been established. If every 8 women in the United States get cancer of the breast, you must imagine the wealth of experience that medical practitioners in the United States would have for treating the disease because it's so common. And there are protocols that have been established that all the world follows, so you'll be wise if you discover something like that and have it dealt with. So before, say, 25 years or so ago, every woman who had cancer of the breast had their breasts removed. And not only their breasts removed, sometimes the muscle of the chest wall, every woman, regardless of stage, because they used to believe that cancer of the breast is an isolated disease. But what was discovered is that after you do this operation, women still died from cancer elsewhere in the body. And so it was discovered that cancer of the breast is really a systemic disease. By the time you discover it, there's a probability that cells have already left there and gone elsewhere. So the treatment for cancer of the breast that is some distance from the nipple and of a certain size is no longer mastectomy. You do what is called a lumpectomy. And you take out the glands from the armpit because the cancer spreads from the breast to the glands in the armpit. So the glands in the armpit give you a measure of how extensive the cancer is. Now, the doctor, when he removes a lump from the breast, a cancerous lump, does not skim and try to really, if this is the lump here, he does not stay exactly on the lump. Because the cancer of the breast is something like a pumpsite seed. That there is a physical lump that you can see and feel, but there are prongs of tumor that spread around from that lump. And so you have to do a wide resection of the lump and take out the tumor. Whenever you have a lumpectomy and axillary dissection, that means removal of the node, that is not the end of the treatment. You must have radiotherapy to the chest wall because you might discover that there is one lump, but elsewhere in the breast there will be foci of tumor that have not yet become evident. And so if you just do that operation, a year or two afterwards, you will see a new tumor developing. So the idea is remove the gross tumor, give radiotherapy to kill the local tumor there that may be in the breast, and if the nodes in the armpit are positive, then you must have chemotherapy. Because you must presume that since the cancer reached the glands in the armpit, then they may have escaped to the body. And they will not be yet evident, but they'll go to your liver, to the brain, to the bone, and to the ovaries. So if the glands in the armpit are involved, then you'll be sent to St. James, where they're going to give you radiotherapy and chemotherapy. Now, to say something about chemotherapy. Every woman hates that because sometimes it involves loss of hair, and nobody, besides the nausea and vomiting, loss of hair. So I tell my patients when I see them that for the time they make a diagnosis, number one, start to wear a wig before you have chemotherapy, so that when people get used to see you wearing a wig with your hair, when you have no hair, they'll still think you're wearing just a wig. So I tell them that, and I also tell them, don't tell anybody that you have cancer of the breast, because when people see you, they always remind you, oh, you're still alive, you know, you're looking sort of, you know, make you remember. The thing is that you have to live your normal life and forget the disease. So I tell them, don't tell anybody, because that's how human beings are. They'll remind you all the time. Mastectomy means removal of the breast. So you remove the whole breast down to the muscle, close the wound, take out the glands from the armpit. Now, fortunately today, women don't have to walk around looking lopsided, because after a mastectomy, there are braziers that have a prosthesis within them, or you can have an implant of a prosthesis, or doctors, plastic surgeons could take some muscle from your abdomen, tunnel it under the skin and make a false breast here, or take a muscle from the back and create a false breast here. And you look completely normal. I'm sure you have met women like that and you don't know. Yeah. Okay. Let's talk about ovarian masses. Am I using too much time here? Oh. Ovarian masses. Cancer of the ovary is a very dangerous disease, but it does not announce itself early. Most times people discover that they have cancer of the ovary is long after the disease has been established. But the ovary does not only have cancerous tumors, it has non-cancerous cysts. The size of an ovary is the size of an almond. Everybody knows what an almond is, isn't it? Almond from the tree? Everybody knows the size of an almond. And I have removed ovaries that look like a term pregnancy weighing 35 pounds. So that to tell you how big these cysts can become. They can be cancerous or non-cancerous. And you can have a solid ovarian tumor that is non-cancerous, or you could have solid ovarian tumors that are cancerous. And you have some ovarian tumors that produce hormones, like male hormones, and so women can develop beards and mustache and all those sort of things. Let's talk a little bit about cancer of the ovary. Generally, it happens in women 63 years of age and over, although it can occur in any woman at all. I do recall once I had one patient, she's just got married, she's 26 years old, and developed pain in the right lower abdomen that simulated an appendicitis. So I went in there to remove the appendix and found that she had a cancer of the ovary, or early cancer of the ovary. I took out only the treatment for cancer of the ovary is removal of the uterus and both ovaries. But this lady just got pregnant, just got married, so I tried to be a little judicious. I took out only the ovary that was affected. The next morning I went and said, well, you know, you did not have appendicitis, you had a cancer of the ovary. I hope you didn't take out both of my ovaries, you know, doctor. So I said, no, dear, peace be still, peace be still. You know, I took out only that ovary. She was advised, do not go and get pregnant because you'll make the tumor flare up. She promptly went and got pregnant, and of course the cancer started to develop in her abdomen, and the gynecologist advised her to abort. Absolutely, she refused. I don't know the end story, but you can see that it can happen. She's 26 years old. Although most of them happen in 63 and up, it can happen earlier. And the symptoms include lower abdominal pain. Early on, there's generally no symptoms. Early on, so because the ovary is a solid organ, organs that are hollow tend to cause pain early on. So low abdominal pain, bloating, weight loss, poor appetite, constipation, and irregular vaginal bleeding. Of course, that you can see from those symptoms, there's nothing specific about the ovary. People get bloating, people get constipation, and all of that, and have no ovarian cancer. So you see the difficulty in suspecting that disease. Well, if you became suspicious for any reason, then you go to the doctor, and you start to lose weight rapidly, and you are eating like you normally eat. You suddenly start to lose all this weight, or you're having this abnormal bleeding. Then you go to the doctor, and he will examine you. He may feel a mass, he may not feel a mass. One thing he may feel is a lot of fluid in the belly, because cancer of the ovary, as it advances, may cause liters and liters of fluid in the belly. So you can have all 15 liters of fluid in the belly and look like a term pregnancy. So he may find that on examination. Then you may do an MRI and a CAT scan. You may see the tumor inside there. You can do a fine needle biopsy. That is, you just put a needle and suck out a little bit of the tumor. You make a diagnosis. You may do a barium enema X-ray because of the constipation and find that the tumor is impacting on the bowel. You may do a chest X-ray and find that there's spread of tumor there, and then there's a blood test that you can do, C125. The treatment of ovarian cancer involves removal of both ovaries, tubes, uterus, and omentum. And omentum is a fat pad that hangs off your large bowel. It's like an apron hanging in your belly. And cancer of the ovary love to go into that thing. You're just a whole cake of tumor when you go in there. So chemotherapy is the mainstay of treatment. And finally, I'm talking about a condition that affects both women and men, but mainly women. It's called osteoporosis. And what it means is thinning of the bones. Now, you have a hard bone, you know. Some people say they have hard bones. And I think that after you have grown and you have the length of your bone, that the bone is something static, but the metabolism of the bone is very active. You continually break down bone tissue and build up bone tissue. That is continually going. So what happens when you grow up? As you grow, you build or create more bone tissue than you break down. But after you reach about 25, 30 years of age, you break down more bone tissue than you build. And bone is made up primarily of calcium and other tissues. Calcium is what gives it its strength. So after 30, you start to lose bone, more bone than you build up. And particularly in women, calcium absorption is decreased when the female hormones are decreased. So when women become menopausal, it's very difficult for them to absorb calcium from the food that they eat. And therefore, the bone just keeps on becoming weaker and weaker and weaker, so that a slightest stress on the bone may make it break. You just have to twist your ankle and the bone will break. You know, it becomes very, very brittle. And it happens in men too. So how may you suspect that you have an osteoporosis? You may suspect that if you start to have back pain. You know, every day you are sitting normally, you're not sitting on a computer and couch like this. You know, that may cause back pain. And then you find that your back is hurting all the time. Loss of height. You may lose your height because the vertebrae may become compressed. It becomes so weak that your vertebrae become compressed, and rather than looking like a bobbin, it becomes like a biscuit. So you lose height. And then you may get a stooped posture. I'm sure you have seen some old ladies that you saw men like that too. What happens is because the vertebrae become triangular. Normally, your vertebrae is rectangular. You know, your vertebrae is rectangular. When it becomes triangular, it becomes sort of wedge shape, and you get the crouch. You get the crouched appearance. So if that starts to happen to you, then you have to worry about osteoporosis. And then you go to a doctor, and you'll get a bone density test, and it will show the degree of osteoporosis that you have, and the treatment is calcium. Well, as I said, calcium does not get absorbed well from your gut if you do not have hormones, both female and male hormones, and vitamin D is essential for its absorption. So the treatment is to eat lots of green leafy vegetables and foods that have vitamin D, fish oils have a lot of vitamin D, some from sunlight, but some people don't want to take sunlight. So if you take some sunlight, they're afraid of getting melanoma or getting too tanned. So take a lot of vitamin D from other sources, and calcium. Not all calcium is easily absorbed, but there are a variety of calcium, and there are foods that have calcium. So a good text, this world has a lot of suffering, but we can depend upon Jesus. I am the Lord that healeth thee, and he'll do that when he comes. Thank you, everybody.